allow me elaborate more about the myths. I talked about myths earlier, and there are a number of myths that move around about hernias. And commonly we have had, I've also engaged with clients who tell me that, Musao, the hernia of the kundi, if you put a coin, they told us it will go. Or if the baby's ankle steps on the kundi, it will resolve or it will heal. Now we have to remember that these hernias also have what I can call grades, but not really grades. But the difference in you remember we said it's a hole or it's a defect. Now the size of the hole also matters. Here it is not the. I've always heard people saying hernia the enkuru nento, or a hernia that is old and a young one. Really, there is no old and a young hernia. Maybe what you mean is that you have had it for many years, because you see most times the symptoms of a hernia are more of swelling. There is really no pain, and usually it's pain that brings patients to hospital. So when there is pain over the years, after having it for 10 years, he comes with pain, he says a yonkuru. Then when he has had it for a few months or weeks, he says, honey, a child into bangambi. They told me the one that is young, I don't touch it. But you don't remove the fact that you have a hole or a defect. So whether the defect is 10 years or 5 years, because even the one of 10 years started with 1 day. So it is still a defect. Now, this myth of umbilical hernia, where we say we put a coin. Now, the coin, remember I've talked about the sizes. You will see that you and your classmates, let's say when you're in school, you had a classmate who had a big kundi, another one had a medium one, for you have a small one. Now, all those are different sizes of the hole. Now, remember, as you grow older, that hole naturally closes. Now, the difference why some people grow up and they still have big kundis, because their hole was very big. So the natural narrowing or closure was not possible because the defect was very big. Now, if it is slightly smaller, why the coin works, when you tie there a coin, or when you place a coin there and you leave it there for some time, is because that coin promotes, inside it promotes formation of scar tissue. So it helps that kundi to close off, but that should be a kundi of considerable, that should be a defect of considerable size. You're not going to get a very big defect and you say you are going to assist closure with the coin. That's why you come and say the coin failed. Then another one tells you, my child, the coin worked, you use the coin. No, the coin worked on your child because your child